Hey guys, welcome back to my channel. So today I'm going to be talking to you about PTSD, its risk factors and treatment options, and then different types of treatment. So I am not in Colombia like I thought I was going to be doing my travel video for you guys, because unfortunately I got another car accident. So I know in the last video I shared I got in a car accident on the 2nd, and then I got in a car accident on the 7th. So that accident actually is ironic because it was very traumatic and it gave me the short-term symptoms and signs of PTSD. So I was hit in a 4-car collision, hit and run. The girl hit me. She was doing probably like 50 miles an hour. Caused me to hit 2 other cars. It totaled my baby. I'm so sad. But I'm alive, and that's the most important thing. So since then, I've been, healing, just taking it a day at a time, working through the pain and stuff like that. The good out of it, my mom was able to come down here. So we canceled the Colombia birthday trip, but I got to spend my birthday with my mom. So that was cool. So last video about PTSD, I talked about what it is, what it ain't, what it causes, things that come with it. So this video, I'm going to be talking to you about who more so gets it because of risk factors and what we could do to treat it. So not everyone who lives through or experiences a traumatic event or experience is diagnosed with PTSD. And actually most people don't get diagnosed with PTSD. So who gets diagnosed with PTSD? Who gets it the worst? People who have existing risk factors. So these risk factors could happen before the event, happen because of the event, or happen after the event. So a combination of these risk factors is what kind of determines whether or not a person doesn't get diagnosed because they don't have these different symptoms, or they do get diagnosed and then they have like a more severe case of PTSD. So what are these risk factors? Living through or experiencing a dangerous event or a traumatic event. Getting hurt. Seeing someone else get hurt, seeing someone else die, or seeing a dead body. Childhood trauma, whether it's severe or not severe. Feeling horror, helplessness, feeling guilt, feeling shame, or feeling extreme fear. Having little or no social support or family support, or any type of support after an event. Dealing with or having extra stress. So this could be, losing a loved one. This could be, an injury or an illness that comes after the event. Or this could be losing a job or not being able to work because of the event, or isolation because of the event. And then, as always, a history of mental illness or substance abuse. So if people have more of these risk factors, they're more likely to be diagnosed with and have PTSD. So now that you know the factors that, combined with the traumatic experience can cause PTSD, how do we treat it? So how do we treat it? As with all mental illnesses and things I've talked about in the past, psychotherapy and medications are on the top of the list for treatment because they work. They work when done consistently. So psychotherapy, they want you to start at 6 weeks. 6 weeks to 12 weeks is like the average, 6 to 12 weeks of consistent psychotherapy. And remember, psychotherapy is nothing more than talk therapy. So why or how can talk therapy, psychotherapy, help somebody with PTSD? So it teaches them about trauma and the effects. Because how can you heal if you don't know what it is and what can come from it? Just like I told you the effects before, somebody might not know it and they're experiencing these things that they don't know how to get better from it. They use relaxation and anger and anger control skills. So they're teaching you how to be relaxed. They're teaching you how to control your anger and emotions and control these different skills. They provide tips for better sleep, for better exercise, and for better diet. Because a lot of times when we get in the midst of a traumatic experience or a big experience that changes how we think or how we act or how we operate, we might not do those things that were second nature to us before. So they teach us better habits, because you do lose sleep, you do lose the desire to eat, all these things. And then it focuses on changing how you react to your PTSD symptoms and how you not to say lash out, how you engage and interact with other people, because you might avoid things because it puts you back in that moment, or you might lash out when people don't understand things. But talking to a licensed therapist, they can help you ensure that you get through whatever it is that you're going through. So that's psychotherapy. Medications, as always, antidepressants, anti-anxiety, sleep medications, pain medications, so on and so forth. Because as always, these things, it's like a cycle. Like, sleep affects how you eat affects how you sleep. That affects your depression, that affects your anxiety affects how you sleep, anxiety affects how you eat. So it's all a circle. So all of these medications kind of work hand in hand, because if you're sleeping better, then you feel better. If you feel better, then you might eat. If you have anxiety and you're controlling your anxiety, it'll help control, So the list goes on. Medications, you got to go to your doctor to figure out what works for you. And if your medications don't work, continue to go to your doctor and continue to take the medications. Don't just stop because you feel better. So the last thing that is specific to PTSD is, not specific. Okay, the next thing that most people with PTSD can get treatment for is cognitive behavior therapy. That is a special category within psychotherapy, and it has different types of therapies that will help you out with trying to heal from this trauma. So the first one is cognitive processing therapy. So I talked about this before with, I think, the depression series. So with this is where your therapist or your doctor tries to change the processing of how you feel about the trauma. So it doesn't change your memory, but it changes the emotions and the feelings associated with the memory. So if you feel guilt or shame or anger or fear, they take you back in that moment and they basically erase the emotion that's associated with it. And if they can't erase it, then they try to, make it less severe so that it doesn't affect your day-to-day. And so then you have prolonged exposure therapy. So with this, they actually put you back into that experience. So in a controlled environment, they re-expose you to your trauma, or they re-expose you to triggers of that trauma. And from there, they help you learn ways to cope with it, learn ways to heal from it, learn ways to change how you, the outcome of it. So, well, not the outcome of what happened, but the outcome of how it affects you. So they slowly but surely put you back in that traumatic experience. And then over time, they repetitively put you back in that experience or that time point in your life, or, that trigger. So, and the intent is over time, you aren't affected from it, or you aren't affected as bad, and you have better ways that you express yourself, or you aren't as fearful or sad or whatever the emotion is associated with it. So then the last one is group or family therapy. So this is where they involve you, they take you to group therapy where people have experienced the same thing or they have the same symptoms, and they give you their experiences, and through that you have somebody that you can lean on who understands what you're going through. Or family therapy is where they involve your family in your treatment so that your family is instrumental in helping you heal. And then once you stop therapy, your family has, started that process with you. So they know what you're going through so that they understand it better. And basically it's a licensed therapist or counselor or mediator. Somebody is present that can kind of help you through the therapy. So as always, I hope this video has helped somebody. If you don't think it's helped you, then maybe it'll help somebody else. So I need your help. I need you to share this video. Please share this video if it's helped you, or you think it could help somebody else on, you know, your timeline, in your life, you know, share it through text, any of that. Please like this video, because I know it was some good information for me, because it is definitely helping me get through all of the traumatic experiences I've been through. And hopefully it can help you or somebody else that you know with their experiences as well. Please comment if you feel so, if it's helped you, if you've learned something. And then subscribe. Please subscribe to my channel, because the content will only get better from here. And I hope you all have a happy new year. I hope that 2020 brings you better mental health. Brings you better mental health with the help of me. So I hope to see you more in 2020, and I hope that, you know, we can heal ourselves with, you know, the knowledge that I give you, or the knowledge that you give me. So have a great day, have a great new year, and I hope to see your notification soon.